This week on List Rate Rank.
Now, it's not as bad if they improved your face, but I don't think my face can be that much more improved.
On List Rate Rank, our hosts research various topics and each bring their own top 5 list to the show. Together they debate, discuss, and deliberate, and with the help of an expert, one definitive and indisputable top 5 list is created.
I think I've been proposed to at least 15 times.
This is List Rate Rank.
Welcome to List Rate Rank. I am David Fedor.
And I'm Felicia Gillespie.
And today we are talking about Anesthesia Fears.
I'm so scared. David. All of my fears are on this list.
Oh, for real?
Yeah, don't put me under. Don't do it.
It's a terrifying thing if you think too hard about it. And that's all I've been doing for the past week researching this topic, is thinking of how dangerous going under anesthesia is.
Yeah, is it actually really dangerous though?
I don't know. I mean, if you want to just poke the hole in my whole entire, let's just let the drama out of the episode right off the top of the bat.
I think it's so relaxing that you might die. That's how not terrifying it is. It's like taking a vacation from your conscience.
So for those of you listening who might not know what we're talking about, anesthesia, I looked this up on Wikipedia, so I want to define it. Anesthesia is a state of controlled temporary loss of sensation or awareness that is induced for medical purposes. Anesthesia enables the painless performance of medical procedures that would otherwise cause severe or intolerable pain to an unanesthetized patient or would otherwise be technically unfeasible.
So gross.
Yeah. So it's basically allowing, surgeries to happen without completely killing people.
Yeah, back in the day, they would just knock you out with a hammer, right?
Or like booze, probably.
Yeah. Yes.
Or bite on this stick. Arr!
Yeah. I just get all my medical information from Three Stooges shorts. So
they do a lot of surgery on Three Stooges.
They knock you out. The anesthetic, bam. That's how it goes.
Nice. Well, there is 3 types of anesthesia. Local anesthesia, which numbs the area being treated. So it's a smaller region. So it's cream or an injection. Think like Novocaine when you go to the dentist. That's local anesthesia. Regional anesthesia blocks nerves to a specific area. So it would be like a shot in the back that numbs your body or something like that. Like women go under a cesarean section, they don't knock you out with general anesthesia. They just paralyze you from like the neck down, I believe. And then there's general anesthesia, which is medication to knock patients out cold, so they go sleep.
So you the first one was local anesthesia?
Local, regional, and general.
Okay, so local is something they use now when you get your wisdom teeth taken out. Is that correct? Or just a tooth? Oh, you're talking Novocaine. Okay.
Novocaine.
Gotcha.
Yeah, general anesthesia I think is for wisdom teeth.
Okay, gotcha. Yes, that's what I went through, and I was about to be very upset if they switched it.
Oh yeah, now you don't have to worry about all of that stuff. Well, so you have been under anesthesia then?
For my wisdom teeth being removed, yes.
Did you wake up groggy or do anything stupid?
I did. I did something stupid before I even got put under. I wore like this crazy button-up shirt that was like this bright metallic green. And for some reason because I was like, I'm going to make the dentist laugh when he's pulling my teeth out because I was an idiot. So I did that. And then, when I woke up, I just kept wanting to go shopping. I was like, let's go shopping. Let's go shopping, everybody. And they're like, no, you can't go shopping. Not a good time for that.
You're walking sideways right now.
Yeah.
I didn't do anything crazy when I got my wisdom teeth out, but when I went to the dentist once, I got nitrous oxide, and it was fantastic.
Was it?
It was the best experience. I could totally understand why people get hooked on like doing that. Because for like a good month afterwards, I was just craving it. Like it was like, this is good shit.
Really? Did you
Yes.
tell? I think you might have told me this before.
So
Somebody else told me this.
so I went to the dentist, right? And I had to just get cavities filled, but Novocaine doesn't work too well on me. So whenever they like drill or clean or like poke, I could still feel everything. So they were like, "Oh, do you want to do nitrous oxide?" Like if you feel it, it feels just like a little bit of pressure, and then you don't care about it. I'm like, "All right, sure, let's try that," because Novocaine doesn't. And I hate needles. Like they would stick like 10 shots of Novocaine. The person who put me under, the doctor, she's like strapping it up, and she's like, "Hey, if anything goes wrong, just raise your hand and let us know, and we'll back this off. Because if you have too much, you could get really messed up." So the dental assistant comes in to start cleaning to get my stuff going, and she's like cleaning away, and the lights there, and then the TV's on the ceiling mounted above me, and Impractical Jokers reruns were playing. So I'm like trying to watch Impractical Jokers and not pay attention to this, and then all of a sudden I start tripping balls. Like time is warping. I'm hearing things from the TV on a loop in my head, like cascading down in like this weird, and I'm just like freaking out. I'm like, uh-oh. So I put my hand up, and nothing happens. The dental assistant was just kept cleaning, right? She keeps going. I'm starting to panic a little bit because I'm like really starting to feel this stuff, and I'm like, I'm gonna die. For a good minute, I was convinced I was gonna die. So then I put my second hand up in the air, and the dental assistant did not stop. And I'm like, well, this is how I go. I guess I overdose on nitrous oxide in a dentist office. So I might as well enjoy it. So I start just watching Impractical Jokers, totally tripping out and having the best time. The doctor came in, filled the cavities, they sent me home or whatever. What I haven't mentioned was my wife worked at that office at the time, right? So she was a dental hygienist. And I explained to her, I was like, I was tripping insanely. I was putting my hands up. They weren't stopping. What should I have done? And she's like, I don't know. A week later, she comes home and she's like, oh yeah, by the way, I talked to that dental assistant. My wife asked the dental assistant, was everything okay? He didn't embarrass himself. He didn't embarrass me. And she was like, oh no, he was fine. He held his hands up in the air for a little bit, and that was weird. But other than that, it was fine. And I was like, that was the signal. That was the signal. I could have died. So that was my best experience with anesthesia.
Yeah, that's very scary. And when I went under for my wisdom teeth, I remember the guy saying to me, breathe for me. I kept stopping my breath, and he was like, I need you to breathe for me. And then I would just like take a big deep breath in, and and I'm like, oh my God, I didn't realize that could happen. You could stop breathing.
Yeah. I think a lot of my top 5 at least have to do with fear of not being in control. Because you're literally putting your life in the hands of this person who's now controlling your breathing and controlling your heart rate. It's scary.
Woo!
All right, so what do you say we get to our lists?
Let's do it.
All right. My number 5, having nasty side effects. Number 4, having somebody do something wrong. Number 3, having a family member film you doing something stupid. Number 2, waking up during the procedure. And my number 1, not waking up after the procedure.
That's a pretty good list. My number 5, defecating. My number 4, dying or not waking up. My number 3, being sexually assaulted. My number 2, organ removal for the black market. And my number 1, accidental plastic surgery, especially on my face. How about that list, David?
Wait, didn't you say that a lot of these happened to you?
No. No.
Or no, a lot of these are actual fears you have.
These are my fears. Now, some of them I did get from the internet.
All right, well, That is a very scary list, and anybody undergoing anesthesia better fear all of those.
Yeah, I agree.
So we're going to take these two lists and combine them into one list of 5 to take to our expert later on in the show. Never waking up is my number 1, and we'll go into the top 5. Your number 4 was dying, so that is out. I have control of that because I had it ranked higher. Now, number 4, I have having somebody do something wrong. So I was going to expand upon that while we were talking, and have like somebody chopping off the wrong limb, like taking off the wrong leg, or somebody touching your junk. That was going to be wrapped up in there. You have your 3, 2, and 1 are all kind of the same kind of thing. Something happening that's not supposed to happen. So I'm going to eliminate my mistakes, and whichever ones of yours make it in there will be yours to control. So having nasty side effects was my number 5. What I wrote down.
Effects? I mean,
So people react differently to these drugs that they're pumping into your system. So for instance, I wrote paralyzed, piss yourself or something. So that's close to your defecating.
Yes.
But notably for me, my wife had cesarean section when we had our kids, right? So the first time she delivered, whatever anesthesia they gave her, she shook violently for like the entire procedure. And, both arms are strapped down, and she's hooked up with the oxygen or whatever gas they're giving her, or whatever. No, it was like a IV. But she was like almost seizure-like, just shaking.
Wow.
And the anesthesiologist was like, yep, it'll do that. And it was one of the most terrifying things for me to experience, because there was nothing I could do. Of course, more terrifying for her because it was happening to her. So, but I felt helpless watching it. So those kind of side effects, I would definitely be, but that was something that we were definitely conscious of going into having our second, is if that same kind of reaction was going to happen with the anesthesia. Luckily, it wasn't as bad the second time around.
Yeah, that's, did it happen again though, a little bit?
A little bit, yeah, a little bit, but not too much. So,
wow, that would definitely be terrifying if she didn't know, she's just shaking, and then she's like, what is happening to me? And the doctor's like, oh, you're totally fine.
Yeah, this
am
is after...
Am I though?
We didn't go back to that hospital. Let's just put it that way.
Wow. That's, okay, so that's a legitimate side effect. I mean, are there other side effects other than like defecating or urinating and then violently shaking? I mean,
I guess paralysis, or some sort of like if somebody's injecting a needle into a nerve in your spine and injects it wrong, there's a risk of like, not being able to walk again or something like that.
Yeah, that's a valid one, but you know what? I mean, you can never being able to walk again is pretty serious side effect. I don't know what the numbers are on that, the odds of that happening, but yeah, I mean, some shaking, that's scary, like defecating, that's on my list, but I'm not really going to fight that hard for it, because it's like, what's a big deal? I mean, even if you do, you're in a hospital, you're dealing with doctors and nurses. They'll probably offer to clean you up, I'm assuming, maybe not, but I don't know what's the worst that could happen. You just bring a change of clothes in case that happens. So I don't know. That side effect thing, not that scary. I mean, and also yours was not waking up. Your number 1, and that was mine, like death, not waking up. But that's my number 4, because it's like at this point in my life, I wouldn't care if I died, really. I mean, I'd be like, yeah, that's cool. I might die. All right, cool. Let's do it. And if I live, hey, it's like I get a whole second chance, right? So that's not really that big of a fear, but sexual assault. Now you could say like, hey, you wouldn't even know that it happened, which technically you probably wouldn't if it wasn't that forceful. But if you did find out that it happened, that's a huge violation. So, or you might be like, hey, that doctor was hot. All right, that was cool. I still got it, right? But I also noticed that I didn't find this anywhere on any other lists. I'm the only one who fears this. There was a fear listed, people afraid that they would make sexual advances while they were under. And I'm like, well, what does that say about your character? You know, if you
Yeah,
if you
like,
are
look,
more afraid, yeah,
all
of
day, every day. That's all I do. Everything I do,
yeah,
my conscious body is 24/7 stopping me from assaulting people sexually.
yeah. So I don't know, being sexually assaulted, yeah, that's it's a pretty big one you would feel, you know. But if you never knew, how would you ever know? How would you ever know? So I don't
Well,
know.
I'm sure.
I don't sound like I'm even arguing for that one very much.
Well, I'm sure there's probably a bunch of people who are banking on that you'll never know. Um,
Yes.
so,
Yes.
and I'm sure it's happened. I'm sure it happens way more often than people. I've seen Horrible Bosses. Isn't that what one of the main storylines in that movie was? Was
I
Jennifer?
saw it happen in Undercover Boss. No, I'm just kidding. Yeah, I don't know, man. The character thing where you're afraid of making sexual advances, and then 50% of people, you probably saw this one. They did 400 questionnaires, and 50% of those people were afraid of revealing personal issues while they were under. And I'm like, that's not a fear of mine either, because I live my life in the truth, right? I'm on the straight and narrow. I'm a good person. What kind of lies are 50% of people keeping out there that this is their big fear? So
I think we're seeing a lot of them boil to the surface in the year 2020.
yeah, this whole year we're all in a coma basically. But so, okay, maybe your side effects is more power. What else do you got? What
Well,
else?
but besides side effects, I mean, when I said having somebody do something wrong to you, would be
Yeah.
something like losing a limb,
Oh, that's not a side effect of anesthesia.
that's not a side effect of anesthesia. No, that's a fear of while I'm under,
Yeah, yeah.
somebody's going
Yeah.
to take advantage of me.
Oh,
So
separately.
yeah, it's separately. So I had that rank 4. You have it rank 3, and specifically as sexual assault. So I think they coincide, and I think this one goes to our list. And because you had a rank 3, you have control over that.
Okay, that's going in there then.
So not waking up is going in there because it's not my number 1, but waking up during the procedure to me might be even more terrorizing and scary. Like horror movie-esque. Like imagine waking up and like looking around and seeing like some doctor there having a smoke and like having your entrails laid out on a table.
Oh my God.
Somebody sitting there taking a selfie. It's like, what is going on?
David, you have described a very horrendous scene. Yes, that would be terrible if they were smoking in the surgery room. That's very,
We gotta cauterize
unhygienic.
this wound somehow. Cauterize this wound.
With your insides out on the table. Oh my God, that would be very terrible. People taking selfies. Oh my God, yeah. I mean, when you put it that way, or you could think like, oh, I got like VIP tickets, this is, I'm like behind the scenes right now. I get to meet the cast. Okay. And they all look over and like, oh, just go back to sleep. You're fine.
This was all a dream.
That is the scary one. Yeah, but it's only terrifying when you put it like that. I mean, you have to be having, yes, like transplant surgery in order for your organs to be out on the tray. Yeah, you're right. We should put that one in.
Well, speaking of transplant surgery, your number 2 was having an organ removed unwillingly.
I don't know science. I'm not a doctor here. We'll have to ask Dr. Sunday, but how many organs can you live without? What if they just took all of the live withoutable organs out of your body and you wake up and you have like stitches or something? You're like, what the hell happened?
Well, if you woke up without the non-livable ones missing, then you wouldn't wake up, right?
Oh, right. So how do I say that?
I mean, one of the big things is waking up in a bathtub full of ice, reaching to your back, and being like, oh my God, what happened to my kidney? That's like one of those campfire tales.
And you're smoking a cigarette,
right? Taking a selfie. What is going on? I was just supposed to have my teeth out. This was supposed to be a dental appointment.
I mean, can you imagine just having like all of those, stitches and whatever gauze all over you? And you're like, oh my God, and you don't know where the people are. You don't know where you are. And you didn't even make any money from it. They made all the money. So you don't even have anything left,
Yeah,
if
but at least
you need an emergency fund.
Yeah, at least they left a note on top of the pile of ice in the tub. Call the hospital right away, because they cared.
I can't wait to get Dr. Sunday on here to clear all this up.
She's going to be like, this wasn't how any of this goes, right?
Yeah. She's gonna, really wake us up here.
But this is like legit. People think this way, I'm sure. Because I think this way.
I did. I think someone's going to take my kidney or something.
Well, tell me about this plastic surgery you have as your number one.
So look, that's the number one, because if you wake up and you don't look anything like you used to look.
Are you talking like face off, removing and replacing faces?
Yeah. Or it could just be maybe they plumped up your lips a little bit, gave you a nose job. Right now, it's not as bad if they improved your face, and look, I don't mean to be like egotistical here, but I don't think my face can be that much more improved. Like maybe they can like slim down my nostrils a little bit. I have pretty big nostrils. That would be an improvement, but I'm okay. I'm happy with everything else. So if they gave me a different face, I'm like, oh my God. I mean, I get to live a different life now. I get to start over, but I lost that awesome face I had. That's a big fear.
That is a fear, I guess. All right. So the other one that I had on mind, the last one that we have to talk about and consider, would be the viral blunder. Having a family member filming you doing something stupid, like sitting in the car. All these teenage kids are doing it when they're getting their wisdom teeth out. They're tripping balls and saying, "Oh, I want to go shopping," and then it gets posted online, and then you're a laughing stock at high school for the next 6 months.
I think you would gain so many friends. I have to debate you on this. I think people would think you were cool. I think it would make you popular. I think because it goes viral, it would make you feel like, oh my God, this is, if you're not doing something too embarrassing, like unless you're getting naked or something like that. But if you're just saying weird things, I think it's actually, I don't know. Why would you be afraid of that? You just be afraid of being embarrassed?
Yeah, you'd be embarrassed. Yeah. And although you're right, if they do post it online, they can't be too embarrassed.
Yeah, you could have a sitcom in the next month. You'd be on Ellen. It'd be great. Your life would change.
Yeah, here's $20,000 to cover the cost of the bill, and we're sending you to Disney World.
Yeah, saying something stupid while waking up from anesthesia is the new Johnny Carson. You're an overnight success on YouTube now.
You don't get to sit on a couch. You don't get to sit on the couch yet, but you do get to be in the studio.
Yeah. So I don't even know if I know that's a personal fear of yours. I don't have very many feelings left at this point in my life. So I don't know if I can be embarrassed by something. Like, it might be embarrassing, yeah, if I was like naked or something. But I mean, even then, if I was in shape, I wouldn't care. I'd be like, hell yeah, show that body, let's do it. So what was okay. So I'm going to, out of yours, I'm going to say the somebody doing something wrong you said was similar to the sexual assault, but I mean, I think they could be two different things, right? Like we could
losing a limb.
Yeah, like we could have both, or just like doing the wrong surgery. I almost put that on my lists.
Yeah.
They could be two separate things. Waking up during is already on. Not waking up is on.
Yeah, so not waking up, plastic surgery, sexual assault, and waking up are 4. So we just need to fill that one last one. So it could either be having your organs removed by, unscrupulous hospital staff.
Yeah.
Or like a mistake for losing a limb, having the wrong arm be removed or something.
Do not downplay my face-off plastic surgery here, David.
It's in there. Regardless, you put it as your number one, so we do have to actually take a doctor.
Yes, automatically goes in.
It automatically goes in.
Okay. All right. So
Yeah.
sexual assault and someone doing something wrong.
You like
Okay.
it?
Well then,
No,
yeah.
no, no,
And
no. It's going to be organ removed or losing a limb. Those are the two that we have to. You want to flip a coin for it?
yeah, gain or loss. Let's flip a coin.
Do you have a coin? I don't have a coin.
I have one sewn into my belly button right here when I'm trying to get my
All right, hold on. There, I got one.
mole removed.
All right, so I have found a Canadian quarter.
Ah, shit.
So we have a moose head on one side and
That would be heads.
queen of something on the other. So there's two heads on this coin. One's a deer head and one's a queen head. So do you call deers or queens?
You know, I'm going to say tails would be losing the organ and heads would be gaining a limb.
We just we just established it's heads and heads because it's a deer head and a queen head.
I'm confused.
All right, so here's the coin.
Yes.
A deer head is on one side
Yeah.
and a queen head is on this side.
But we have to decide which one represents which one.
Right, and you said tails is the one thing, and I'm like, neither of these is a tails. They're both heads and heads. It's not a deer ass on here. It's a.
You just have the moose head be the head and the other one be the tails because a moose head is strictly just, it's a queen's.
Yeah.
Okay, gotcha.
I mean, I guess.
Do we have a second coin to decide which one?
All right, here's a good old American quarter.
This episode is surreal, everybody.
George Washington.
Oh yeah, this is how you do it. Patriotic America. America is better.
Heads, losing limbs. Tails, organ removed. It is heads.
Okay.
So
For
losing
losing
limbs.
You could also say gaining limbs. Pick a sew on another arm in there, and that's part of.
Yeah, losing
Honestly.
limbs or just wrong procedure.
Yes. Losing/gaining limbs.
All right.
We have our list for this wonderful doctor who's going to be horrified.
This might be the first time that somebody's ever stopped halfway through the expert round and been like, you know what? Plastic
I'm
surgery
out.
face? Yeah, I'm out.
I have to go put someone under right now.
All right, so to take to our expert, we have never waking up, plastic surgery to your face, sexually assaulted, and having a wrong procedure, such as losing a limb.
Yes.
All right, join us after the break. We're going to be ranking these with our expert, Dr. Renee Sunday, after this.
Hey everybody, this is Jeff, the host of Stuff I Never Knew Trivia Game Show podcast. Each week, 3 players from around the world call in and battle it out over 3 rounds of trivia. Each week there's a new show. You'll meet new people from around the world. We have over 80 episodes. We're in season 4. That's the Stuff I Never Knew Trivia Game Show podcast, available everywhere you listen to podcasts. That's StuffINeverKnew.com, StuffINeverKnew.com, that's StuffINeverKnew.com.
All right, welcome back. Dr. Renee Sunday is known as the Platform Builder. She is an award-winning, board-certified anesthesiologist, media personality, publisher, best-selling author, coach, grief counselor, motivational speaker, and an anesthesiologist. Dr. Sunday, at her core, is a humanitarian and has always been deeply inspired by helping others from all walks of life. And today, she is our guest expert on Anesthesia Fears. Dr. Sunday, welcome to Liz Straight Rank.
Thank you. I'm so excited to be here.
We're thrilled to have you. Now, you reinvented yourself. Can you tell us how you transformed yourself from an anesthesiologist to an entrepreneur?
Oh, wow. You know, life happens, right? I'm going to just say that, right? It's depending on how you take that pain to purpose. I am, like you said, a board certified anesthesiologist. I followed the steps just briefly from my sister. She actually is 4 years ahead of me, but I was that nagging little sister. So I followed her, and she's a family practice physician. And then I said, well, I don't want to put people in the hospital per se. And so I love, medicine. I love pharmacy and those type of things and how it reacts with the body. So I naturally evolved into anesthesia. And I've been doing that now for 20 years, but I had that funny feeling inside, you guys, that I wanted to do more. Like, okay, what more? But life happened, and you know what year I'm talking about, right? The year when it just didn't, in the real estate, it happened in the medical field. I lost my job. I went from 6 figures to 0 in one day, 24 hours. And I'm like, okay, what's really going on with this? Okay. But I found another job, but I still felt something. And so my brother passed away a month later. And part of my therapy, and I'm gonna say it just like that, I actually start writing, journaling. Didn't know I had the gift of writing. And next thing you know, I started writing. I took a $27, and I'm gonna say that, publishing class. And the people love my writing. They say, how can you be so motivational, inspirational of something that's very, very difficult to talk about? So that became my first book. Then it went to the publishing company. And in 2013, you guys, not really a lot of physicians was on social media. And so I had to get on social media to really promote my book. And a lady inboxed me, not knowing me, not knowing anything really about me, but besides my message, she invited me to be a co-host of her radio and TV show and be part of her magazine. And people continue to pull me aside and say, you need to do this on your own. And I stepped out on faith, and I never look back. So I've been so excited when the lights come on, I'm a whole nother person.
Entrepreneurs, they have their hands in everything, and you have just so many things going on. How do you balance that?
Well, my main goal in life really is to help people smile. And people say, wait a minute, smile? Because if you're actually in your purpose or going towards your purpose, something that you love to do, something that you bubble inside, you smile. And when you smile, you help your family, your children, your neighborhood, and next thing you know, people in the world is in their best version. So I actually have a lot of systems, but the secret is I help people identify their purpose if they're not aware, and we build a platform. And I always say to be seen, be heard, and get paid, because you want to actually monetize what you're doing.
Well, yes, you're speaking to me directly right now. So, Dr. Sunday, you were named one of the top 100 anesthesiologists in the country by America's Top Anesthesiologists from Consumers Research Council of America. So congratulations. That's awesome.
Oh, thank you.
We're fascinated by the mental aspect, the fears of going under anesthesia. What's some of the things, without telling too much about your patients, because I know you can't say that, what's some of the weird things that you've seen and experienced in putting people under?
Well, I've been I want to laugh. I think I've been proposed to at least 15 times. And then usually people say, get out of my bedroom, because when they wake up, they like, okay, why are you in my bedroom? And being a lady, they like, okay, wait a minute, what's going on? But I think the hilarious thing, I've been proposed to several times. And because, when people wake up, they're like, wait a minute, who is this beautiful lady? And I'm like, it's your anesthesiologist, okay? But I take it very serious, because one patient said this, and I want to say this quickly. She was, and I want to say her age, of course. She was in her early 80s. She said, $1 to go to sleep, and all the money that we charge is to wake up. I said, you may be right. And then she also said, you take people so close to the divine than any other aspect of the world. And I was like, wow. But what I do, ladies and gentlemen, I make sure I take care of every patient like they're my family. Because if you don't do that and you take it from an inward spirit, you won't be happy. Because people say, how can you do this for 20 years? Because I enjoy making sure people actually have a successful surgery, and to make sure it's peaceful as possible, because there's so much out there where we'll get to people believing in what anesthesia is about.
Well, tell us a little bit about, because we chatted at the top of the show with Felicia and I's research, as brief it is. If it was off of Wikipedia, there's a chance that I probably didn't even read it. But there's local, regional, and general anesthesia, right?
That's correct. You got it in a nutshell. That's it. Yes. Yes, you know, I tell the patients in a nutshell, it's something to our madness. But you know, I have to say this, our body is so amazing. Our body has a lot of, and I'll say it simple, bells and whistles. We have the cells that's doing their thing, the hormones doing their things, and all of that is so amazing how it's put together. But you know, when you go to the dentist and they numb your teeth, that's just local anesthetic, what they call it, mostly lidocaine, that it numbs the nerves. Isn't that amazing? So the nerves in just local area. And then if they put it somewhere else, it numbs that particular area. Now, when we do what's called general anesthesia is when we put you to sleep by IV normally, and the medicine actually puts your mind to sleep, number one. But then the more medications we give, it actually, I'll be honest, it does stop your breathing. That's why we put that little device in your windpipe. When you're asleep, you don't know when it goes in, you don't know when it comes out. But we do monitor you throughout the whole process, and of course throughout the procedure. Now, the one in the middle, what we call is deep sedation, what they say, or monitored anesthesia, which is also kind of like a deep sedation or twilight. You probably heard people say that. That is usually for the procedures you've heard of, colonoscopy, or upper endoscopy, when they look into your stomach or stuff like that. That's when a patient is actually breathing on their own. They're not on the ventilator. We're not helping them breathe. They just doing a normal thing that we do on a daily basis. But we are monitoring them the whole time while they having the procedure or the surgery. But it's actually so amazing, I have to say it again, how our body responds to things, because we do that and boom, we pop right back up and we're back to our normal self.
Well, that's awesome. And it comforts me to know that, you know, the people who are doing it are responsible to pay attention to that, because it's literally a trust thing. You're trusting this person to give you the right amount of dosage, to monitor your breathing and your heart rate. And that's pretty much everything. And I think that's what inspired a lot of our things on our list. It was that fear aspect. And Felicia now will tell you our top 5 list. Here's our top 5 list. We need you to let us know what you think they're ranked from 5 as least important and 1 as most important.
Mm-hmm. Yes, and you know, coming from the comedy world, we got a little crazy with it, but here are the 5 you have to choose from to rank. So, not waking up, being sexually assaulted, waking up during the surgery or procedure, having the wrong procedure done, or getting accidental plastic surgery.
Oh, wow. I think in this season of what we're dealing with nowadays, and even prior to that, is not waking up. I think a lot of people are very concerned about that. And as you mentioned earlier, they are giving us that control. We see people cry sometime, or, you know, just really have a quote unquote out of body experience because they've given up that control, but they concerned that they won't wake up.
So that would be your number 1?
Yeah, that'll be number 1. And I think after that is doing the wrong side nowadays. I think I will put that as probably, if I'm not talking in my medical, from the patient's point of view, they would probably say that is number 2, because they're concerned that they're going to do the wrong surgery. But really and truly, we have a lot of checks and balances in places that that's really
like people like marking with Sharpies on like this one.
Yes, we mark it. Soon as they come in the building, most places verified as soon as they come in. And then when you get passed off to another person, they actually do it as well.
Nice.
And then after that, I would say number 3 waking up during the procedure, right? That's what you mean?
Yes.
Yeah, because people think that they're gonna wake up because they may have had someone talk about that before in the media or something of that effect. So I would think that would be the next one, that they'll wake up during the procedure.
Mm-hmm.
And then what was the other one you said?
Being sexually assaulted or getting accidental plastic surgery. Or you're.
I would think the unfortunate, having the sexual assaulted probably be next.
Okay.
But if you got we don't play none of that crazy stuff.
No.
No, I actually, because you may have heard a lot of people have music when the surgeon does the procedure, but I make sure I actually have whatever music the patient wants and that same type of music when they wake up. Because you don't want someone that loves, let's say country, then all of a sudden we got some hard rock doing this. And they're like, oh, what is this? So we make sure we do what's best for the patient. And then the last one will be the plastic surgery. Yeah, we won't do that.
That's not even a realistic thing. That's just something Dave and I invented. Dave or I invented. We don't know who it is yet.
Well, I'll point it out right here. It's definitely yours,
okay.
Felicia.
Thank you.
So
that was in my brain.
Yeah, that was in her brain. That was her number one fear. She didn't want that pretty face of hers messed up. But that gives us scores of 3 points for Felicia. I got 12. I cleaned up. So I won this episode. And that's because I live in my fears way more than Felicia does.
Yeah.
Although I tell you, if I woke up during surgery and Bee Gees were playing, I'd be all right with it. I'd be like, this isn't so bad. Let me let's finish the song out and then put me back under. So
that's funny.
So that was our top 5, and like we said, they might be a little off the wall a little bit. What is the top 5 that you brought with you, Dr. Sunday, that you see a lot from your patients and their point of view?
Well, I actually at first I was like, ooh, I got this. But you know what season we dealing with now. So a lot of people concerned about if they're going to, have any type of, infection or something like that when they leave or what's going on in the world. So I think that'll be number one. People concerned about that because, we have to have our protective gear in place. So I would say that's number one. That's what most people are nervous about, and delaying a procedure, delaying going to emergency room and that type of stuff. But I want you to know we are safe. We are safe. And then the next one I think would be, like you said, waking up during the procedure, or not waking up, because some people are concerned about at the end they not waking up. So, yeah, so that's the thing. And then next is pain control. A lot of people are concerned about not being, and I'm gonna say this in quotations, addicted to pain medication. So they concerned about how we're gonna manage their pain control, because they don't want to take the medicine, but you really in that setting need to actually have pain medication. So a lot of people are concerned about that. Now this one is a lot, and is nausea, because you hear a lot of people are nauseated after procedures, after surgery. So me and my practice, and most people in the anesthesia field, we give patients what's called pre-operative, but before they go to sleep, we give them a regimen of anti-nausea and anti-throwing up, anti-vomiting medication. So that's a big concern, because most people, they put that as one of their things they want to make sure that doesn't happen with surgery. And I think the next one would be, it was a tie. Will they actually really be asleep during the procedure? Because it has been in the literature that people have had, they dream, and they actually dream that they are awake during the procedure. So we for sure don't want that, excuse me, to be a concern of the patient. And then I had a tie there. The next one I thought people would be concerned about is the expertise of the staff. Because I could be very transparent now. Sometimes the anesthesia provider only talks to the patient 5 to 10 minutes before the procedure. But what usually comes with that is whatever facility, keep in mind that we are well credentialed. I mean, if you Google me, you'll see all the credentials that I have. We spoke of a couple of them prior when we first started, but we're well credentialed. I went to school 12 years for this and been in practice 20 years. And we take it very serious. Some patients say that I'm the police officer of the operating room, because nothing's going to happen to the patient, that we are not going to allow that to happen, okay? Mm-hmm. But we're going to be there for a safeguard, for protection, and make sure everything done in a spirit of excellence and make sure the standard of care. So that's why I put that, because some people are concerned about, are we really trained? Are we board certified? I, knock on wood, haven't had a patient ask me that. The good thing, they always say I look too young. So I like that part.
Yeah, 20 years practicing,
Yes. And one thing that patients may not realize, and even the family, is usually the anesthesiologist or the anesthesia provider, you don't see us in post-op. We're gone.
Yeah.
And the reason why, of course, we have other things we have to do, but we make sure that you're back to where you are before we leave your presence. And then in recovery, when you wake up and enjoying a little snack before you go home, we know that we have done what's best for the patient. And that brings me so much joy when I teach students. Students say, well, they don't say thank you. They say thank you when the person is wheeling them out to their car, when they are wheeled up to their room so they can rest overnight. Yeah. That brings you joy that you have done what you're supposed to do in providing care for the patient.
So you mentioned your number one was infection and things like that. I didn't even think of the things that had to have changed with surgeries now in this new world, life after COVID. That has to be an incredible change to your routines.
Yes. And I'll be transparent. You probably have seen a lot of people in the medical field, and not even really the medical field, the scrubs we wear. You would go everywhere and you would see people in scrubs. And you probably won't see that nowadays, because most people, and myself, my regimen has totally changed. I actually totally changed, and even, shower and sanitize and all that stuff before we leave the hospital. And then sometimes if we can't do it right before we leave the hospital, we do it immediately upon, arriving at home. I mean, my shoes stay in the garage. It's a whole different regimen that we do. But you know what? We're proud to be in the medical field. We're glad that we're here to serve. And that's the whole thing, is to serve people and serve them with the standard of care. That's the main thing that I had to buy separate shoes that I only wear in the operating room. And we always cover our hair anyway in the operating room. So with anesthesia, I've heard that a lot of the medical staff now cover their hair with some type of wrap, but we already had to do that. But the thing is, I think we had to really realize, and I'll be honest, I never realized that we were per se on the front line as people are referring to us, but we're glad to be there because we're still doing the same. We're still providing care, because now the patient's stress level is at a whole nother level. So we're there to help them relax. And a lot of patients now, like we said before, they are saying, thank you for being in your service. Thank you for doing that. And that's very nice. But you know what? We are happy and we're glad we went in the medical field, because let me say this real quick. I met 3 young nurses, and they would, because now you have to stay in a certain area until they let you up to the different floors. And I just felt that I need to stop and tell them, because I saw the look, if you will, on their face. I said, you made the right decision. You in the right place that you need to be. And one of the ladies said, I'm so glad you stopped to say that. We really needed that. And I'm like, oh, I'm so glad, because we need that encouragement. And a lot of people need that encouragement right now to continue moving forward and what you're called to do, what you were created to do in this world.
That's great.
But keep in mind, we are always there. We're there monitoring you, and you know, it takes the team. It's the team. You know, of course, the surgeon, whoever's doing the procedure, you know, us and our assistant and the nurses, the scrub. You know, we work as a team to make sure everything's done properly, and it's a success. Because the whole key is to get you from that procedure back to your quote unquote normal, you know, because people say, I don't want to feel like I've been drinking or drunk or whatever. But, you know, it comes really quickly after. The anesthesia now is much different than it used to be in the older days, that you have a hangover 2 and 3 days. Now you pretty much back to yourself within, I mean, really 4 to 5 hours, the max 20 hours.
Well, something we joked about at the top of the show is before anesthesia, before it was drugs, it was like what? Just drinking a ton of wine or getting hit over the head, knocked out, biting down on a stick? What?
That's funny. You know, it's some of our equipment, and I'll be honest, some of our equipment was only invented in 1980. Just think about that. 1980 I mean, that's a long time, but really not a long time. So it's been a lot. It has evolved a lot beyond. You've never heard of the truth serum and the laughing gas. It has gotten to a whole nother level. We have computerized ventilators, computerized, if you're in the hospital, that medications through a pump. So technology has really afforded us advancement in the anesthesia arena.
Well, all of us patients all over the world, thank you for getting it all right and improving things. Again, thank you so much for all this information. It has, you know, put our minds at ease and also made us feel a little bit better about thinking about some of these things, because, you know, fear is a real thing and it's okay. And we know to talk with you and the people like you to get more comfortable with the procedures. Can you tell us a little bit about how we could find information about you specifically? I know you do a lot of work outside of, you know, anesthesiology with helping businesses and being a coach. Tell us a little bit more about where people could find you.
Yes. And thank you guys so much. This has been an amazing experience as well. I make it easy for you, okay? My branding person did an amazing job. Everything that I do is on my website, which is Renee Sunday, and it's Sunday like the day of the week, SUNDAY.com. And that helps the patients too, because my last name's Sunday.
Yeah, it's fun talking to Dr. Sunday today on Tuesday. So it's reneesunday.com, RENEESUNDAY.com.
Correct.
Awesome. Well, thank you so much.
So much for the opportunity. I've had a blast. Thank you.
All right. Thank you.
Nice to meet you.
All right.
Bye-bye.
Please rate and subscribe to List Rate Rank on Apple, Google, Spotify, or YouTube, and find our bonus content on listraterank.com. Follow @ListRateRank on Twitter and Instagram, like List Rate Rank on Facebook, and join our Facebook group to get in on the fun. Thank you for listening to List Rate Rank.
And many more.
David, don't put this in. What if they gave you like a second dick? How would you feel about that?
Where is the second dick?
Excellent follow-up question.